Hi everyone. Today we are going to discuss about diseases of respiratory system. And the first, asthma. Asthma is a long-term inflammatory disease of the airway of the lungs. Your airways narrow and make too much mucus. A condition in which a person's airways become inflamed, narrow and swell and produce the extra mucus which makes it difficult to breathe. And asthma can be minor or it can interfere with daily activities. Here you can see the symptoms of the asthma. Asthma is characterized by the recurrent episode of sneezing, shortness of breath, chest tightness and coughing. Sputum may be produced from the lung by coughing, but it often hard to bring up. So here the treatment is avoiding the triggers, inhalated corticosteroids. Prevention, according to the World Health Organization, recommended to avoid the tobacco, smoke and stay away from the air pollutions and chemical irritants. Here you can see in the diagram what happened to your lungs when you have the asthma? Lungs with asthma and without asthma. Here you can see in the lungs without asthma, the mucus is normal, about of mucus, and the lining also normal. Here you can see the with asthma, excess of mucus and it is closed. Swelling lines you can see here. And the next disease is bronchiectasis. It is lung condition where your airways tubes going into your lungs get damaged and widen. Inflammation and infection make your bronchial walls thicker. Here you can see the diagram. Damaged cilia, excess mucus, normal mucus. Symptoms: cough with lots of mucus and pus, repeated cold, bad smelling mucus, shortness of breath. These all are prevention treatment, avoiding cigarette smoke. For all the respiratory diseases, prevention is avoiding cigarette smoke and get away from the chemical hazards. These only they will give. Preventions. Treatment antibiotics or it may take surgeries also. This is about bronchiectasis. And next, chronic obstructive pulmonary disease. It is also called as the COPD. Refers to the group of diseases that cause airflow blockage and breathing related problems. This long-term condition gets worse over time. It includes the bronchitis and emphysema. Here you can see the diagram. It is a pulmonary disease. Bronchioles narrowed and blocked with the mucus. Here you can see the clear picture already given. Emphysema, alveolar destruction, bronchioles. And the symptoms: frequent cough, excess mucus, sputum, phlegm, shortness of breath, trouble taking a deep breath. Treatment: quit smoking, avoid tobacco smoke. This is about the chronic obstructive pulmonary disease. Pneumonia. Pneumonia is an infection caused by the bacteria, virus, or fungi. It leads to the inflammation in the air sacs of one or of both lungs. The sacs called alveoli fill with fluid or pus, making it difficult to breathe. An infection causes inflammation in your alveoli. They might fill up with the fluid or pus. Here you can see the symptoms: cough, fever, shortness of the breath, chest pain, and headache, feeling of tiredness. Here you can see the diagram. See. Healthy alveoli and pneumonia. Here the pneumonia is air sacs filled with the fluid. This is about the pneumonia. Prevention is same for all the diseases. Treatment also maximum same. Next, tuberculosis. A bacterium causes this dangerous infection. It usually affects your lungs but might also involve your kidney, spine, or brain. Tuberculosis (TB) is an infectious disease usually caused by the Mycobacterium tuberculosis bacteria. So here you can see the symptoms: fever, chills, night sweats, appetite, loss of appetite, weight loss, and fatigue. These all are the symptoms. Treatment same, antibiotics. Here you can see the diagram for tuberculosis. This last stage, it causes whole lung. This is about the tuberculosis. And next, lung cancer. Lung cancer is a disease caused by the uncontrolled cell division in your lung. Cells in your lung change and grow into a tumor. This often happens because of smoking or other chemicals you have breathed in. Symptoms, the same symptoms for all the respiratory diseases, and treatment also same, but in the lung cancer it may take surgeries, I think. Lung cancer treatment includes surgery, radiofrequency, radiotherapy, chemotherapy, targeted drug therapy, these all. And not all lung cancers can be prevented. Stay away from tobacco, avoid random exposure to the chemicals. These all are preventions and treatment. Here you can see the diagram. Tumor formations in the lungs. In the final stage, it will affect both the lungs. And next, cystic fibrosis is a genetic disorder that causes the problem with breathing and digestion. This disease is caused by a problem in your genes and gets worse over the time. It causes the lung infections that don't go away. And the symptoms, cystic fibrosis signs and symptoms vary depending on the severity of the diseases. Here you can see the diagram, cystic fibrosis. The airway become narrow, thickened mucus. This is about the cystic fibrosis. And next, pleural effusion. Pleural effusion means water on the lungs. Too much fluid builds up between the tissue that line up your lungs and chest. Symptoms: chest pain, dry or non-productive cough. Why here they mentioned water? Can anyone know the layer which is covered by the lungs? If you know, please comment in the comment section. Here you can see the diagram of pleural effusion. There are three parts in the lung. I will show you the picture. For the pleural effusion, in the inferior lobe, here you can see superior lobe, first part, middle lobe, and inferior lobe. In the inferior lobe, we can see that more water formation. That's what they call water and the lungs. Here you can see is this is the inferior lobe. This part, inferior lobe, superior lobe, middle lobe. This is about the diseases of respiratory system. If you want more videos on other diseases of the system, please comment below for what you are looking. And thanks for watching. Please support me guys. It will help me to do more videos. Once again, thank you.